typical candidates are usually in the 4, 5, 6 range when children first start going to school, because that's when it becomes an issue that they are potentially getting made fun of by people that they go to school with. But the other age group is somewhere in the 20 to 30 age range, and that's mostly because they may have been bothered by a condition in their childhood, but they didn't have the resources or they didn't have the support to undergo any kind of procedure. So they waited until they were a little bit more independent to seek intervention. We do have a range of patients that will come in noticing that their ears are either asymmetric or that they both stick out a little bit further from the back of the head than they would like. And there are obviously measurements, so we really want this portion of the ear to be 2 centimeters or less away from the head. But that's not something that somebody would necessarily know about themselves. So we often have times where patients will come in and be bothered by a particular quality about their ear shape or how far it sticks out from the head, and then we talk about what we may be able to do to address that. There are also patients who have an absent fold here, so it makes the top part of the ear stick out further than they would like, but this part's actually fine. So these are the kinds of things that we look at in our initial consultation, take lots of measurements, and make sure that the 2 sides we can achieve some symmetry for, and we can address the concerns that they came in to have addressed. Surgery can be performed one of 2 ways. One, under local anesthetic or a little bit of sedation. And local anesthetic is basically just injecting a little bit of numbing solution, and the patient's totally awake the entire time. Some patients are really able to do this well and would like to avoid a general anesthesia or recovery from a general anesthesia. Most of the time, these are adult patients. The vast majority of children will do under general anesthetic, but in the same situation, it only takes about an hour and a half or 2 hours. So even under a general anesthetic, it's relatively short. Unfortunately, insurance doesn't usually cover this because there's very little functional use to pinning the ear back. In fact, most people who have a little bit more prominence, or in some cases have something like a cup ear, actually lose a little bit of their hearing when the ear is pinned back. Not to any significant functional detriment, but the more funnel-like the ear is, it certainly does improve or enhance the amount of sound a patient's able to pick up. So insurance considers this a completely cosmetic procedure.